Hi, my name is Kiki Hansen. I'm a doctoral student with the University of Cincinnati, and I'm doing my Doctor of Nursing practice as well as my psychiatric mental health nurse practitioner. And the project today I'm really excited to talk about, and thank you for watching this video. A little bit real quick about me. I am a psychiatric registered nurse and also an ER trauma nurse, and I wanted to explore the possibilities of helping trauma patients improve their symptoms and also improve their quality of life, and basically see if we can add an adjunct service or another therapy to their already psychotherapy and maybe medication, depending on who you are and where you are in your healing process. The project takes place over 10 weeks, and it's very, very simple, and it's groundbreaking. There hasn't ever been anything done like this before, and I thought about this while I was a psychiatric nurse. I worked in inpatient and in crisis, and I saw how trauma can affect the patients. And of course, I have patients right now myself that I deal with that have had a lot of trauma. And we know psychotherapy helps, and depending on whether you're doing CBT or DBT, but this is something that I think that will aid as an adjunct therapy or an adjunct service to actual psychotherapy. The project takes place over 10 weeks, and it's extremely simple. Once a week, you would email me a survey, which I'm going to have another video up on this channel to explain how. I can also do one-on-one training. The survey is literally just, did you do the intervention or did you not? The project is about healing touch, and when I say healing touch, as we all know, I'm sure somebody in your life may have been ill at one time, if not yourself. And when we look at this in nursing, we look at, how touch actually can improve vital signs and improve pain and improve all these other things. So it got me thinking, what about with people with trauma? It depends on your trauma, of course, and where you are in your therapies, whether you're doing therapy with or without medication. So basically, healing touch in the project. The healing touch is non-sexual. It can be with anybody. If you sign up for this, you're expected to do at least 5 days a week. It doesn't matter what days, twice a day, between 2 and 10 minutes. Touch can be anything from a hug, from a handhold, from a side hug, from somebody, putting their hand on your arm, something that gives you that energy, that feeling of comfort. And basically, like I said, it can be anybody you trust. And then there's a weekly survey that you email to me, and your name's not on there. When you sign up for the project, you're given a number. So the email is HIPAA compliant. The information that you're sending me, there's no names on it or identifying, no date of birth, nothing like that. And so basically, it's just a survey that says, did you do the touch? What days? How long? What kind of touch? And who did you do it with? Was it your wife, your husband, your friend, your family member, your daughter, your son, somebody you trust? Basically, we want to see whether or not it's something that gives you comfort, something that helps in adjunct with the therapy that you're already doing to help your symptoms, to see whether or not when you start feeling panic, if somebody actually, just puts their hand on your arm, that gives you comfort, that keeps that racing heart from going, that actually helps in keeping those symptoms at bay. A lot of people with trauma tend to also have sleep disturbances where they have insomnia, they can't get to sleep, or they have night terrors. And, I have patients right now that we treat with trauma. And one thing about trauma is that the actual response to trauma is the same pretty much across the board. The traumas that happened are actually different. And we know that, and we acknowledge that. So this is something that I really am excited about. It's something very dear to me. It's something that I think will be beneficial. But of course, in order to do this, We need participants like you who would take place and be willing to commit to actually doing this and sending me the weekly reports. In this actual project as well, there's 2 phone calls and there's training, and I'm available. I have a specific email and phone number for myself as well that literally you can call, email me if you have questions, if you want to impart some information that might not be on the survey. The other questions on the survey are simple. Is this something that you would continue? So every week, I want to know, is this something that is helping you, or is it not helping you? Because that's just as important. I think this is really groundbreaking, and I really would like to see if this works, if this is something that I can, impart the information to other clinicians to maybe let them add this to their therapeutic regimen for you. As clinicians, we have a toolbox. We have, things that we use. Obviously, your diagnoses, medication, therapy, and teaching coping skills. So I'm really excited about this project, and I really truly hope that this video kind of explains it to the best of my ability, and to kind of give an outlook and a reason. Really quick, I just want to say, I come from a veterans family, and one of the reasons that I decided to do this is because I watched my father and my brother both struggle with PTSD after Vietnam and the Gulf War, respectively, and neither one of them got treatment. And there were many, many things that happened between the insomnia and the sleeplessness and the anger issues. And unfortunately, with my brother, there was drug use involved for quite a number of years until he finally did seek some help. And so this is something that is so important to me, just as important to you. We care about our patients. This is why we get into this. We want to see healing happen. We know that it's not just a mental health issue, but a physical health issue, because they go hand in hand. And so I just really would like to study this. And when I say study this, I mean get some information from people that are using it to, have some breaking new ground in mental health when it comes to treating trauma. So I really hope that you're interested in that. You join us in this, and just let me know if you have any questions. Thank you so much.